So I always want to check the range of motion improvement. So just like last time, what you're going to do is you're going to kick the leg out straight.
Yep.
And stop if and when you feel your tightness.
Okay.
Okay, go ahead.
Yeah, I'm tight right there.
Tight right there. Okay, so stop right when you feel it.
Twinges.
Right there.
Mm-hmm.
So 45 degrees. And I think you were at that last time,
okay.
Which is fine. But what the fun part was from last time that we noticed is your true leg pain wasn't actually from stiff muscles, but maybe a little bit of adverse neural dynamics.
Yes.
And so when I treat the neural dynamics, nerves, when we talked about what they need to improve, it's that space, movement, and blood flow, right? Mm-hmm. I brought that up last time, I think, too. Yep, of just knowing that we need to work on those three things, because those three things will help you have less leg symptoms, which isn't hamstring, because we have the nerve involvement as well as some weakness into the leg that we found with our testing, which is okay, but we're hoping all of that improves. And so with the within session improvement in the range of motion and the sensation down the leg, so the tightness that you're feeling with the range of motion that we're seeing here, we're knowing we're doing the right things. Okay. And last time was our very first time treating it, but today is going to be a little bit more because we're going to be able to do a little bit more. Okay. Sound good?
Yes.
So you lay down on your back, head right here. Okay, so very similar to last time, you're going to guide me. You're going to feel that tightness that we're talking about, and you'll have me stop when you feel it.
Okay.
Okay?
There.
Right there? Okay. So what I'm going to do is I'm going to flirt with those symptoms, and we're going to come up and down into those motions. Right there?
Yep.
Right there?
Yep.
Okay. So what the important thing is here when we work that leg is that we do the toe movement at the same time, the ankle pressure that you feel. Mm-hmm. So when I taught you to do this on your own, that strap was a little bit higher up on your foot.
Yes.
So we can feel that. And like we talked about last time, the number of reps is a little bit more, a little higher up, because you want to give that nerve some blood flow, some nourishment. Right? Now, normal response to this would be I'm able to improve the range of motion as we go. So it feels better and I'm able to go a little higher. Mm-hmm. I would expect that as we go. What we don't want is the tightness in your hamstring to increase. Okay. How's it feeling?
Good.
Now, I'm not looking at your face, so if you're squirming back there, let me know. Feel okay? Uh-huh. And I'm being really intentional on where this leg is, that I'm staying neutral with your hip. Because if I go over, you're going to feel it more. If I come out, you'll feel it less.
Correct.
Do it? Mm-hmm. I think we got a few more reps here. Do you have any symptoms right now? Right there? What?
Yeah, it's like a pull.
Okay.
Not pain.
Is it better, worse, the same as I'm going?
I would say that it is the same.
Same?
Definitely not worse.
Okay. Same, definitely not worse. I'll take that. Doing all right?
Yep.
I'm going to give you a little break here after this one. So those are called nerve glides. Yeah, so calf symptoms are very normal too, because that sciatic nerve branches off to two different nerves in your calf.
Yes.
And if you really don't feel it in your calf, that means I'm not really pressuring it enough.
Okay.
And so if you are feeling it in your calf, I am absolutely moving it.
Yes,
in
on
the
the outside of the calf is where it's really good.
Okay, yep, very normal to either feel in the back of the calf or laterally as well.
Okay.
Very normal. Okay?
Yep.
Any symptoms right now?
Nope.
Okay, so I'm going to go a little higher. How about right now?
Tight.
Okay, how about with that?
Tight. Oh, yeah.
Okay, so when we do that dorsiflexion, you really feel the difference?
Yes.
So here and then back, here and then back. So different than the last thing I just did, where we're keeping the hip range of motion the same, we're tensioning it at the ankle. Yeah. It's a little uncomfortable, but since it's nerve, it's very much like a light switch. So completely on, completely off, right? That's that electrical burning sensation. You may feel it in your calf still.
Yeah, that's exactly.
Yep. But again, we're not always 100% sure where that nerve is being hung up at to give you those symptoms.
Right.
So that's why we improve it at multiple angles. So that's why I teach you how to move your back to improve the mobility of the nerve at the back, or at the back where it comes out. And then we work on the leg as well. So it's kind of this package deal. But it does take a while, right? And so it's not like flexibility where you just go to kind of go hang out there to get the improvement. And a lot of people think this is a hamstring issue and they just don't know that it's coming from their back or their sciatic nerve.
Yes.
How's it feeling right now?
My hamstring feels good. It's my calf that is feeling good.
Okay, you'll probably always have that, right? So your typical symptoms are in your hamstring.
Oh, yeah.
So that's where we're trying to improve it.
No, it's already.
And this is just level 1. We're not biasing a lot of nerves right now. Feel okay? I'll give your nerve a break. Yeah. Okay, we'll do 3 different doses there, and then we'll remeasure.
Okay.
I want to go a little higher. I want to go a little more into it. Do you feel anything now?
I feel it, but it's not pain.
Feel it here?
Yes.
Okay. Like your typical discomfort, or like more like a hamstring stretch?
A hamstring stretch.
Okay, so not your typical stuff?
Correct.
Okay. And you may or may not feel your typical stuff. If you don't, that's great.
Okay.
If you do, just tell me. Still in the calf? Okay. That's awesome. Right, so I can already tell that's going to be greater than a 45-degree improvement, but a 45-degree angle. So we're going to hang out here.
Okay.
And so like you noticed with the homework I gave you, you're kind of moving the leg the whole time.
Yes.
And we may be up for an upgrade with that.
Okay.
Right, moving into this. It's hard not to help me a little bit with the foot.
I know, that's such a controller.
But just relax that body so I can glide that nerve. So with the space, movement, and blood flow, inherently as we all get older, we have a decrease of space in our back, right, from degeneration and arthritis. So we really focus on the movement to improve the symptoms, and the nerve irritability. So the nerve irritability being how much can you do before you have symptoms.
Okay.
Everybody will have nerve type discomfort with this, but is it to the point where it causes symptoms during your daily stuff?
Gotcha.
And if it does, then we treat it.
Yes.
But everybody has neurodynamics. Like, that's just the way your nerves move. So I see this a lot in my patients who have disc herniations or stenosis or just arthritis.
Yes.
Like in your case, maybe some bulges, but everybody's intensity of the symptoms and severity is different.
Yes.
And even though I've seen herniations who don't have any adverse neurodynamics, and I've seen some bulges who do, right? Okay, last one here. I'm going to go up a little higher. You're going to feel this one. We're going to glide into this motion here. Good. Shake it out a little bit. Slack that nerve. Okay, so then now we just go back to the same testing position, and we're going to test that range of motion. Yep. And we're going to do the exact same test we did before. So you're going to be here. You're just going to straighten the leg until you feel symptoms. Right there? Okay, so 7-degree improvement. I'll take that. And you feel tight.
Yes.
See the other side as well. Okay, no tightness whatsoever. That's okay. All right, go ahead and do one more time and see if we still maintain that improvement. Good, yep. So you've had this for a while, right? And so we want to make sure we're making some improvement that tells us where we need to start, but I'm not expecting complete resolution right away, right? Just part of the package.
Yes.
And so typically when I treat the adverse neurodynamics, it just takes time, a few weeks of doing it, and a lot of it comes from doing your own stuff, your home exercise program. So space, movement, and blood flow, since we can't improve the space with what we're doing necessarily, right? You don't need surgery, and just stuff decreases or space decreases over time. We can improve the movement and the blood flow with what you do. So we're going to keep at it.
All right.